have a particular interest in Latin America, not only because I was born and I live in Latin American country, but also because this region, as other underrepresented and underserved regions in the world, faces the most dramatic projections in terms of the prevalence of dementia in the next 2 or 3 decades. In fact, it is expected that the number of persons with dementia will probably triple by 2050, and this is a rate of increase in prevalence that it is not that's not seen in other parts of the world. So to make matters worse, gold standard biomarkers, such as those that are based on PET scans or genetic testing or other biofluid approaches, are just either completely inaccessible or prohibitively expensive in many regions within Latin America. So this creates, again, a scenario of global inequity. And so the thing is that these language tools for bvFTD, they can overcome some of those limitations. They are not invasive. They are easy to administer. They can be tailored to specific cultural and dialectal properties of different populations that may be targeted with them. So despite the promise and potential utility these tools could have, what you see is that most countries in Latin America have failed to produce any evidence regarding the linguistic profile of bvFTD cohorts. And in those countries where we do have evidence, most of the works, which are very limited, by the way, come from a few restricted centers, so that we are really failing to capture the full scope of the linguistic profile of Latin American bvFTD patients, both in the sheer quantity of papers, but also in the geographical distribution of where that research is coming from. And Latin America in particular poses a number of challenges in this way. First, the existing evidence points to systematic deficits in some basic language domains, such as lexicosemantic processing, or word comprehension, and more basic tasks such as phonemic fluency and semantic fluency. That's quite systematic. But more sophisticated assessments targeting specific properties of language, such as syntactic processing or specific semantic fields, that research, which is proving quite promising in other languages, in other world regions, is completely absent in Latin America, which is a missed opportunity. And going back to the challenges, I think that there are at least two challenges that are particular for this region. First, Latin America, and again, this is not something exclusive to Latin America. This probably applies to any world region you can think of. But Latin America is dominated by two main languages, Spanish and Portuguese, particularly Spanish, which is spoken broadly across the territory. But to say that the vast majority of Latin Americans speak Spanish, it is true, but it's also a simplistic way of sort of perhaps neglecting the vast dialectal variety that exists. So if you take a look at Argentinian Spanish and Chilean Spanish and Spanish that's spoken in Peru or Colombia or Mexico, you will find vast differences in phonological, prosodic, syntactic, and lexical terms. And it will be important to develop tools that are not just tailored to Spanish or so-called Latin American Spanish, which is little more than a fiction, and actually produce not language sensitive, but dialect sensitive tools. so that we can try to really capture those patterns of linguistic deficit that that are shared across different dialects, but also those that may be specific to each of these widely varying dialects. And and then the incorporation of language assessments in the disorder. This is not just something that pertains to Latin America, but if we believe that there is actually a use and a contribution to assessing language in bvFTD, I think that we should engage not just researchers, but clinicians, neuropsychologists, neurologists in different events and initiatives to share with them the potential value of these tools, so that they can actually incorporate into daily clinical practice, not to replace anything that is being done, far from it, but to complement mainstream approaches, to extend them in the pursuit of additional insights for disease characterization, monitoring, and hopefully as a diagnostic support tool.